It takes a village to raise a child. That's a phrase you've heard many times before, and it's true. But that support should begin long before the child is born.
Oh yeah, Chesapeake Healthcare OBGYN recognizes that fact. That's why they're creating a community of moms-to-be through a program called Centering Pregnancy.
Empowerment during pregnancy.
It is stepping outside of the standard or traditional model of care.
That's just one benefit of centering pregnancy, as described by certified nurse midwives Blythe Eberly and Shannon Biesterfeld.
Centering pregnancy is group prenatal care.
An option offered at Chesapeake Healthcare OBGYN.
With the goal of improving outcomes, ownership in your pregnancy and your prenatal care.
Women are placed into groups based on estimated dates of delivery.
It's comfortable, and they come in and we have our group session. It is to promote empowerment for women to create relationships.
The design of centered pregnancy incorporates 3 components of prenatal care: risk assessment, education, and support.
And they get to have more time with their provider, and it is run by us, the certified nurse midwives here at Chesapeake.
Each session begins like a traditional prenatal visit with the same screenings. But there's one big difference. Moms actively participate in their healthcare monitoring.
Women will come in, they will give us their urine sample, they will come in and weigh themselves, they will take their own blood pressure, and they keep track of that this whole pregnancy.
In doing that, they learn more about the relevance of the data that we collect during prenatal visits and prenatal care.
After that, each mom is seen individually to listen to the baby's heartbeat and to make sure the baby's health is good. Then it's time to meet as a group.
They get more time in the group setting with the providers and the centering facilitators and each other. They learn from each other. We are able to cover many more topics in a 2-hour setting than we would be able to in a one-on-one visit.
Although centered pregnancy is not relatively new, it's new to Chesapeake Healthcare OBGYN. Nationally, the program has been proven to decrease the rate of preterm and low-weight babies.
Part of it comes from taking ownership of your health in pregnancy and in the postpartum. Women and families are more involved in their care in remaining healthy in pregnancy, learning more about healthy behaviors in pregnancy and following through on those.
Blythe and Shannon say the women in the groups gain something in addition to a new bundle of joy.
They become friends. I mean, we hope that they do take each other's phone numbers and hang out outside of group and help each other, and because it takes a village to raise kids, but it takes a village to be a woman, and we all need support as women.
And it allows them to open up more. A lot of centering involves reflection, and they get a pregnancy journal that they do homework essentially, and we really encourage them to read through their journal. It helps with discussion and education topics.
The groups meet every 4 weeks until the 28th week of pregnancy, then every 2 weeks up to the 36th week.
So we have centering 1 week, and then they have a visit at our regular, how prenatal care regularly is. It can be with us, or if they're comfortable, it will be with one of our other providers. And then they'll come to centering, and then people start to kind of drop off because they're having their babies.
And just because the babies are born doesn't mean these women won't see each other again. Each group has a mom and baby get-together to celebrate the joyous occasions.
Chesapeake Healthcare's Centering Pregnancy program is available to women who live in the Lower Shore, Maryland counties. It's also covered by insurance.
Oh, that's huge.
Because it is prenatal care.
Yeah.
With lots of perks.
That makes a huge difference right there.